Right?
So don't say anything you don't want other people to hear.
Yeah, that's right.
You're good to go, Kim.
Have to behave.
All right. Well, good afternoon. It looks like a small group right now, but maybe some more will join in. And I'm the moderator, I guess the herder of cats for this next hour. And Jerry is my partner, so we're going to do kind of the dog and pony show here, back and forth, talking about healthcare. And good to see some familiar faces. As Mark Twain said, the rumors of my death were highly exaggerated. I just have been missing in action for a while, but I have the next Power Summit on my calendar, and Lord willing, and the creek don't rise, I'll see you all in July, I hope, in Reading. I want to give Jerry and I just a moment to talk a little bit about our healthcare clients, and I'm going to start first with my most recent, and it's a large hospital network. I was at well, we didn't call them Power Summits back then, but after I joined the network, I was at one of the quarterly meetings, Power Summits, and I think it was David Herlinger who was talking about hospitals, and I thought, wow, that's a opportunity I hadn't even thought about. So going back through some of my contacts, I thought, you know, I think I know somebody from my previous life who's involved in hospital work, and sure enough, he was the CEO of a large hospital, and reached out. We got together at a Starbucks for coffee and just probably spent a couple hours just kind of reminiscing. And he asked a lot about my business and took an interest in what I was doing. But the hospital's tied to a university. And he said, you know, I can't do any type of outside consulting, coaching, anything like that, because we get everything provided for us through the university. Well, I stayed in touch with him over the next 7 years, just every now and then shoot him an email. If I was in his area, we'd meet for coffee. I think I spoke at his Chamber of Commerce and he was there for that meeting. So we just kind of stayed in touch. And a year ago, January, he called me and he said, hey, I'm having this issue with, by then he was not only heading up a hospital, but an entire region for this hospital network. And he said, I'm really having some issues. And he said, I don't think what I need is coaching, but I'd like to see if you know anybody you could refer to me. And I think I got this from Linda. Linda maybe stole it from somebody else, but I remember, you know, saying, hey, just coaching is just a word. So I said, hey, could we just remove coaching from our vocabulary and let's just talk about the results you're looking for and the problems that you're having, and, you know, kind of get the blood on the table. And everything he shared was right in line with what we do as trusted advisors. So I said, hey, would you give us a shot at this? This is right in our wheelhouse. And he said yes, and he was going to get a quote from another company. And make a long story short, we ended up getting that and worked with him for about 6 or 7 months in 2019. And in December, they signed on for a whole nother year. So we're working with him as well through 2020. And the guy who didn't want coach, it's a team of 14. If they have a C in their title, they're in there. So I've got the chief medical officer, financial officer, all the CEOs, hospital COOs, CEOs. So it's quite an esteemed group. And I remember thinking, okay, now that I've caught the fish, you know, what do I do with it? Because I'm looking at these resumes, and one guy's got 2 master's degrees and a doctorate. One guy's a black belt in Six Sigma. I'm thinking, so I remembered talking to, it was either Jim Gottschall or Ron. Somebody said, hey, you know, yeah, they probably have heard it all, but they haven't heard it from you. So we went with executive leadership and worked through that over the last 6 months of last year. And I'll tell you, one of the people in the group has been with Procter & Gamble and I guess a couple of other companies before he came to do hospital work and healthcare work. And he came up to me after the second session and said, this is some of the best material I've ever seen. So kudos to Trusted Advisors for our material. Now, I know we are the ones that bring value to it, so I'll take a little bit of credit for how those sessions were going. But he really did like the material, and that was a great foundation for our discussions. And I was going to say that the guy who didn't want coaching, he also came back and said, I think everybody needs to be coached individually. So not only do we do the group of 14, but all of them get individual coaching in between sessions. So it's turned out to be a really good work for us. So Jerry, I'll let you talk about your client.
Hey, thanks. I'm going to share a screen here. Okay. So, and we've worked with a couple of different healthcare organizations over the years, and also we work with the Arizona Hospital and Health Association, which is one of the venues that actually got us involved with some other healthcare out here. But actually, this healthcare organization that I have on the screen is a major healthcare network, also really expanding out west now, really growing rapidly out here. They were referred to us actually by Mayo Hospital, and one of my alliance partners in my business is an executive coach at Mayo, both in all three of their locations around the country. But one of his people that he was coaching moved over and took the helm of this healthcare organization about a year and a half ago, and called me. And they were hiring a brand new president for the division that handles Arizona and Nevada. And again, it's a C-suite of 14 people. That must be the right number, Kim. I'm guessing that you have 14 in your team and I have 14. Must be a hospital thing. I don't know about that, but there it is. They're facing a number of challenges, and the one is the new leader, and he's from South Carolina, and he is a gentleman. I mean, he is the most polished individual I've probably ever met my entire life. He's just very polished. If I had to critique him for anything, he's too nice a guy. That's probably part of his problem, because some of the stuff going on below him is not good. And so there's been a lot of infighting, posturing, politics. I didn't put on here that this group was also bought out by an even larger network, still operating under their own name, but they really actually are a part of a very, very big healthcare network in the country. The group is very stressed out, extremely stressed out. Everybody. When we did individual debriefs of their assessments, we had people weeping. I mean, these are senior executives. These are not, lower level people. These are the top operating people of this large division. And so that's and it's very clear that they're operating at the base of Maslow's hierarchy. It's every man for himself. That is exactly the way that they were behaving when we first engaged with them. So we instituted a little mini survey, a little 10-question survey. To say that it was telling is an understatement. I mean, it just came out of the woodwork. Everybody was ready to talk about their frustrations. So we instituted a behavioral workshop, and we have a behavioral workshop called Understanding Self and Others. So it's basic intermetric stuff. And we again, they learned a lot about themselves. They learned a lot about others. This is an 8-hour process that we take our clients through. It's almost always the first thing we do. And so that started the conversation about who are you, how do you interact with the people around you, and that was pretty intense. Is a word I'm going to use. Pretty intense. Now we scheduled to do 3 additional processes. One is all about stress. So we've developed a stress management workshop, and we're delivering that stress management workshop to them because they have to recognize the impact the stress is having on them. And that a lot of the reason why they are at the base of Maslow's hierarchy is because of all of this stress. Some of it they're creating themselves. Some of it is the organization in some chaos. And that's a part of it. Once we're done with that, we're going to go into an emotional intelligence workshop. There's a lot of, if you're familiar with emotional intelligence, there's a lot of self-regulation problems. So their lack of ability to control their emotions when they get into highly charged situations is really poor, So that's very important for them to go through. In between these workshops, they're spaced out. There's homework assignments. We're forcing them to interact with each other on certain things. And so it's very intensive. And then the final process is a team building process. And so getting them now, giving them some tools that they can work with so that they are able to find ways to get, and you know, we're using some of, if anyone's familiar with Tuckman's model, forming, storming, norming, performing. If anyone's familiar with that, that's kind of the base of this work, and which we've been delivering for a bazillion years. It's just very effective, and so we will do that. And it's being delivered over 3 months. It was supposed to start in April. It has not started. I actually let the client off the hook, and I'll tell you why, because we were going to just do it virtually. But this group really needs to be sitting in the same room, feeling the tension, feeling the experience together, we believe. And so I said to their CEO, as much as I know that we want to do this, I think the timing is wrong. I think they're so unfocused right now and so focused on the COVID challenges, of course, that they're embroiled in, that this is not the right time. And so we let it go. I had a little, you know, cash flow attack, got over it and moved on. So it's scheduled right now in June. Who knows? Who knows? Probably not is my guess. We're seeing the stuff that was postponed to June in business for us now being pushed out to September by other clients. That's what we're seeing. And then we're going to go into executive leadership development, which we've already been discussing with the client, but they are not ready for that. There's too much tension, too much going on. I also believe that there's at least one, maybe two individuals that need to leave the organization. They just don't want to play. And that can't go on. And I'm sure Kim knows, in these types of organizations, that's not an easy thing to pull off at this level. That, you know, a lot of times these issues are covered up, and you know, and that's what happens. But that's so important here. There's also some one-on-one coaching being discussed, Kim, just very similar to what you're doing, but we're trying to hold them back a little bit because they need some growing up first. I'm going to describe it as, you know, I'm not going to be receptive to one-on-one development when I'm at the bottom of Maslow's hierarchy. I'm not going to. I'm in there fighting for my own, and I'm not thinking about other people or anything else right now. That's still where they are. And so we're going to keep doing that. And then we'll push down into the team as we typically do. And we have as maybe some of you do, we have a 100% virtual management development program, for example, put together. And so we've been doing a lot of distance learning on Zoom, just as we are today. And that's been working extremely well, better than I frankly thought it would. That it's been a really good thing for us and for our clients. So that's what we've done so far with them. I think this is I loved when you said trusted advisor, because that's just how we see ourselves with this client. That we are their trusted advisors. Their CEO will call me, or I'll call him, and we have great conversations. And he finally, as he has described, has someone to talk to. And so we don't ever want to forget, of course, that is our number one, right? Is that the client trusts us and wants to confide in us and seek advice before they do things, and that's the best clients. And this particular president of this group is definitely that guy. He is a really, really easy guy to work with. So, all right. So, do we have any questions?
Jerry.
I'm gonna get into that.
Let me go back and I want to talk a little bit about, have Jerry and I, and thank you very much, Jerry. I had not seen his slides yet, and when you had that first page up there, I thought, wow, not only are our numbers the same, but we're working with the same clients. So all the issues are exactly the same as
We
what
just
we've been
send a
hearing
check
from
to my post office box. Didn't you?
Yeah. Wanted to add too, the yellow tabs, the life wheel can be kind of a hit and miss with people. And we decided to incorporate that into the one-on-one coaching. And I would say 13 out of the 14 people just thought that was outstanding. They have not thought about themselves and life balance and that in a long time. And they really took to the yellow tabs. That's been a success for us. I wanted Jerry and I to share a little bit about what we have now seen with our client in the middle or post-COVID. And I'll go ahead and go first. And the first thing we have heard is just the financial stress on the healthcare system. The network that I'm working with, just in their region, the losses are in the tens of millions of dollars. With the entire network, it's way, 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 way over that. One of them is an emergency room hospital, strictly emergency room. I don't know about your states, but here they did away with all emergency room treatments for a good while. So they lost everything in that hospital, had to modify for COVID, and so they've lost a lot of money there, but just throughout the entire system. So financial stress right now is huge. If you're talking to folks in healthcare, you're going to certainly hear about that. The culture challenge. The reason we had a meeting, we had our first team meeting since COVID last month. The last two have been canceled, and it was done virtually. So we had 14 people on a Zoom call. But when we took them into their breakouts, we had them deal with 3 questions. What has surprised you about yourself as a leader through this crisis? What have you learned about your team? And then third, what do you believe is going to be your greatest challenge in a post-COVID-19 environment whenever that happens? And several of them said their biggest challenge is going to be within the people that they manage, the resistance to go back to the way the things used to be. So they're going to be fighting a cultural change. Something that we certainly can help with through our team coaching and the things that we do. The use of technology is another challenge. They've learned a lot. One of the 14 in my group is the head of HR, and as you know, in healthcare, there's a lot of turnover. They've been doing all their onboarding virtually, and he said, "Why stop?" He said, "It's working. Why go back to the old way where I have to drive 50 miles to get to wherever they are, and we do all this onboarding?" He said, "We can do it through technology." And maybe the biggest opportunity that has come up is going to be the leadership shift. They have found a lot of people in their leadership, not at the level of the 14, but if you go to the next level down or even next level down, they said there's a lot of people that just haven't passed the mustard during this challenge, and they realize they have people in the wrong seats on the bus. And so they've come back to us, and they're already saying, hey, when things settle down a little bit, we need to talk about leadership development because we're going to bring some new folks up. You all know about the skills curve. So they say, we're going to bring some folks up that haven't been in leadership before and, tell us what you can do to help coach them. So that's going to be a whole nother opportunity for us as far as coaching, is helping them with that team effectiveness and leadership development with the folks that are moving up the chain. Jerry, what are you hearing from your clients as far as challenges?
Well, again, we're going to think we're working for the same client because the first words out of the CEO's mouth when we made our decision to postpone the current processes that we had lined up was their financial situation. They've been decimated. They're also involved in building a university on their property where they're going to train medical students right right involved in their organization, and that's a huge undertaking, and they're well into it. And so, I mean, it's not something they can abandon or whatever, but where does the money come from to support all of that? You know, big organizations have the same problems as small ones, you know, when it comes to budgets and cash flow and all of those kinds of issues that they have to deal with. And so that's been a huge issue. And what's interesting about this group is they did not talk about their people. And that just screams at me. They just do not talk about their people because they're so wrapped up in their own situations that they can't talk about their people. And so what kind of leadership, if we were to do a dialogue there, which I think would be a grand idea, I think the feedback we would get would be depressing for this leadership team, you know, but you know, obviously that's the way we bring it out, right? We get it out on the table and we try to deal with it. So in that way, it sounds a bit different from your experience. And that's what this CEO wants. He wants a team of professional colleagues that trust each other, that will tell each other the good, the bad, and the ugly, all of it. Get it out on the table. Talk about it. You guys don't know Laura Dillingham on my team, but Laura's, in my opinion, the best facilitator I've ever known in my entire life. She is phenomenal. She's been with me for 20 years in June here, and she is just phenomenal. And we call her the Pied Piper because she draws out of people all of this angst that they're feeling and helps them then to get over that so they can move to the next place. And that's what we're working on. We don't, and there's all different kinds of approaches. And certainly, you know, I love what you said, Kim, about using the life wheels in the coaching. That is absolutely critical. And their analytics, whatever assessments that you've done for them, because that tells the truth. There is the truth. And so they can deny it all day long, you know. And our favorite question when we're doing assessment debriefs is, so you liked the good stuff that's said about you, and you said it was all true. Now here are some things that are cautionary, and you're not accepting those things. You're denying those things. So tell me about that. And then be real quiet, right? And that's, you know, Laura always says there's an elephant in this room and we're not going anywhere until we eat it. And she will just be quiet until somebody else talks. And it works. You know that. You know, I'm looking at some very skilled facilitators here that I've known for a number of years. Right, Linda? So yeah, so it's you know, that's critical, and that's what I love about the tools. You know, that's what our tools like management development, leadership development, and so on, that's what they get to, right? They get to the truth, and it takes some facilitator skill to get them there. They're not just reading stuff, right, and filling out something. It's the rest of it, and it's the honesty, bringing the honesty into the process that seems to make the difference, whether it's a hospital or, frankly, any other kind of organization, right? People are people. So can we hear from some of the other folks, Kim?
I actually, hi.
Yeah, I'd love to hear questions. Let's hear about your clients, what challenges you're hearing, how you found opportunities. You just open it up for the rest of the time.
Well, I
Go
actually
ahead, Linda.
I actually have a question for both Kim and Jerry. One thing that you said intrigued me greatly. You said that the organization, and I know you guys are in different parts of the country, even though you're working for the same organization, with the same organization, which I think is hilarious. Anyway, you said that through this COVID process that your organization took a look at the a couple of lower levels of let's call it management, and determined that there were, you know, people were in the wrong seats on the bus, and et cetera, et cetera. Do each of you think that that's going to be something that really becomes prevalent in the healthcare industry as we go through this process? I mean, as horrible as this whole thing is this kind of an aha moment for a lot of them to say, wait a minute, you know, we really need to take a new look at this organization? I guess my question is, what do you see as being very different coming out of this, as far as how they look at their staff and their organization?
Go ahead, Kim.
Well, I definitely think there's going to be a lot of changes. I don't know that people are going to be thrown off the bus, but I think they're going to be moved around in the seats, and that's what we're seeing. One of the guys that I coach is the chief medical officer. He fired 2 doctors last week. I mean, in the middle of COVID, he said they're just not they're not holding up their end of the bargain, and they're not afraid to do that. So you're seeing those kind of shifts, and again, they've already begun to move people around in the leadership seats, and that's why they've come back to us and said, hey, when this all settles down, we're going to need a whole nother level of leadership development. I've got a niece that works for a whole different hospital here in Indianapolis. She's also seeing the same thing. There's shifts being done in leadership. People are moving around. So again, not necessarily being thrown off the bus, but they're definitely moving them around in leadership positions.
Yeah.
Anybody else seeing similar? Yeah.
I think I see the healthcare world as very hierarchical, and they really they do a poor job overall, to the extent that I've seen, of developing a team and having people ready, more so even than other private industry clients. We see that there too. And so key employee development is something to be talking to. That's something we all should be talking to our clients about, whether they're healthcare or they're not. Who is ready? Because what happens is we have a large engineering client that they had a 5-person leadership council in their business. 2 of them retired last December, and they were just going to move some people up, and we stopped them and said, wait a minute, are they ready? Let's evaluate them. And we did, and they are not ready. And they would even tell you, those individuals would tell you that they're not ready. And so now we have a key development program going on, and we're developing those people. And I said, you can operate with a 3-person council for a while. You know, what's the magic of 5? Is there? You know, first of all, I think 4 of them is unnecessary. I think there should be 1 person making final decision, but that's not the way it works sometimes, you know? So, you know, I think that's very important, and that's a huge opportunity for us, because we drill down into the organization further, right? If we're talking to people that are not yet in management, we actually can help them develop their leadership skills before they get there. You know, what a novel approach, huh?
Bob, I see you nodding your head a lot. Do you have something to add?
Yeah, well, that is a novel approach, Jerry. That would take all the fun out of just throwing them in the deep end.
There you go.
Oh, yeah. But well, one, thanks for sharing. It's great to hear the success you guys have in these situations with the materials. I had a little different angle. One of the reasons I saw the title healthcare. So my background is in manufacturing operations, and I spent 5 years in Asia and learned how the Japanese do the Kaizen, which I call it easy Kaizen. But anyway, it ended up, it's probably as successful or more successful now in healthcare than anywhere else, this concept. But I've had trouble breaking into it, because it's not where, you know, all the people who I knew and worked with, or none of them are in that arena. And I was wondering if you guys ever get into the process improvement and that kind of that Kaizen approach, or where they really get people developing and implementing their own ideas. You know, it's that kind of a a kind of an idea-driven organization, bottom-up idea-driven organization. The whole hospital is filled with highly skilled technicians and so on. They know how to restructure things to make them simpler, make them easier, make them faster. And I was just wondering if you ever get in that arena at all.
Jerry, you want to go first, or anybody else?
Sure. Yeah, we do have a person on our team who is a process-oriented person, Lean Six Sigma, very talented, spent 20-something years at Honeywell in supply chain management and other things. Very, very, very sharp person. And you're right, and hospitals are horribly bureaucratic, right? They just, their systems and processes do not support what they're trying to do. So that's another opportunity area. If that's your background, that's another opportunity area to get involved with these hospital organizations, because they don't know how to get out of that. And of course, they're buried in government regulation.
Yeah.
Which is a whole horse of another color, right? That's a different problem. But you know, we always say if you have good people in poor processes, you still have a serious problem. You know, you can't take one without the other. That's a package. I have an operations background in manufacturing too, Bob.
Okay, yeah.
So you know, I watched it for years, and it was a problem. So that's another factor. And so if you have those skills, and of course, there's lots of people around trusted advisors that have those skills, right? I mean, you know, all of the Total Quality Institute days and all of the, you know, statistical analysis and all is there. And so we forget sometimes to reach back into the network, guilty sometimes when we do these things. So.
Very good. Thank you.
Yep.
Other questions, comments? Share some of your own experiences.
I was going to say the one thing that I've been hearing on the calls is affiliates have been saying, no matter what industry we're talking about here, is that the COVID-19 and the handling of COVID-19 and what it's caused organizations to do, whether it's, you know, essential business, non-essential business, working in-house, working remotely, is they said it really seems to be spotlighting leadership and management and how effective or ineffective it is, as well as, you know, processes. What worked yesterday is no longer going to work moving forward. So how do we need to shift, adjust? And I've also heard folks talking about maybe they don't need to do a full strategic plan, but do they need to look at their strategic plan, you know, next 12 to 18 months? You know, how do we need to more, you know, take that, what do we need to do for the next 12 to 18 months in order to go back to living our more longer term strategic plan?
Wendy, we did a webinar for partnered with the Chamber. It was titled Resilient Leadership, which, you know, is just a term. But the focus of that webinar was, and we had people on the call in the for-profit and the nonprofit world. And the focus of that webinar was, whatever your business plan, whatever your plan looked like for 2020, guess what? It ain't valid anymore.
Nope.
So let's get back to basics. And what we were suggesting in the webinar was that the thing to do immediately was a new SWOT analysis. You know, let's talk about, in this new environment, what are we good at? You know, what are our limitations? And then obviously opportunities and threats is a whole new picture based on what's gone on. So let's take a look at that. And then the question becomes, and what can we do about it? You know, and so that was, you know, it was a 1-hour webinar, so we didn't get too deep. But there were, as I said, there were both nonprofit and for-profit folks on the call who all said, yep, that's what we got to do. And it was funny because they want us to repeat the webinar. And Bob and I were just talking about it and said, well, is that premise still valid? You know, if we do the webinar again, or are we so far into it and maybe on the way out of it that we need to tweak that and think about something else? And we haven't finished that discussion yet, but I think starting with a new slot you know, don't throw your business plan out. Let's just start with a slot analysis and see what we need to adjust. You know, what we need to, somebody said they hated the word pivot because it's been beaten to death. But then something came out today and I think it was from Robin. Hang on a second. No. Oh, she referred to it as an inflection point. Said at some point your organization will encounter an inflection point, which I thought was a neat word. It says an event impacting your organization, industry, or the economy, which will significantly change the way you do business and require a strategic response. I mean, I think that's probably an overriding statement. I don't care what industry, profession, et cetera, that you're in. You know, this has, to your point, Wendy, this has had an effect on absolutely everybody. I mean, we're down here in southeastern North Carolina. I won't even tell you about the tourist industry down here. You know, people are hanging on literally by their fingernails. And it's going to be interesting to see restaurants that don't come back. I mean, we just heard about a steakhouse in Myrtle Beach that's been in business for 40 years. Guess what? Ain't reopening. You know, I guess some folks are just to the point where if they're a little bit older and have been doing this a long time, it's like, you know what? I don't want to fight this anymore. So, you know, yes, to your point, Wendy, I think there are universal things that it doesn't matter what the title is.
I also think the statement of coming out of the pandemic is not a completely accurate statement. I think it's going to be a long process. I don't think this is, you know, okay, we're back up and running. It's July 1st, we're back up and running.
You know.
No, I don't think so.
Well,
I think we are in for a long,
yeah.
and so we do need
here, down here, they have just, in Myrtle Beach, they have just, either they just or they're about to allow short-term rentals starting in a couple of weeks.
Right.
And, you know, people down there are going, well, thank God, you know.
Well, Linda, we're having a senior citizen uprising because none of the snowbirds have been allowed to go back to their homes in the north. They're here and it's 106 today and they're here.
That's right.
So
that's right. You guys have been
it's
having
a crisis.
you guys have been having an early heat wave out there.
And it puts a strain on
Crazy.
medical services.
Linda, I really like the idea.
It's a lot.
Yeah.
Go ahead, Kim.
Go ahead, Kim.
I was going to say, Linda, I really like the idea of the slot analysis. That's kind of worth the price of admission here. I think getting somebody just to think about that, and that's going to open up a lot of doors. So, great suggestion.
Yeah. It's like, you know,
Other questions,
let's
comments?
look at our strengths.
So hey, this is Mike Myers. I got a question. So two points that are kind of guiding me. One, I heard of a Japanese restaurant in Washington, D.C., very famous, you know, very successful. And they just decided they're not having in-restaurant dining anymore. They're converting to a takeout and home delivery. They will deliver themselves. They will not rely on a third party. And so they're going to completely transform themselves and never open their doors to sit down dining. The other point is I have a friend who's a dentist and he is eliminating his lobby. He will have his people text them or call them when they get to the dental office and wait in their car. And then they will call them in and escort them directly to the chair. And so I'm wondering if we're seeing other things like other process changes like that across the medical community that might be actually opportunities as opposed to challenges.
Yeah. I will relate one thing to follow up on when you said, Mike. Bob happened to go to the dermatologist for a regular appointment. And he came home and he goes, oh, I got to tell you what happened. He said, I didn't even get in the door. He said, there were questions I was asked at the door, and then they took my temperature, and then they walked me to where I needed to be. And he said the whole process was a lot of questions he had to answer, and a lot of checking, and a lot of cleaning, and a lot of stuff. And I think that's, you know, that's going to be the norm for a long time.
Yeah.
You know, the only certainty is change. Isn't that one of our old quotes? The only certainty is change. And
Absolutely.
here we go. This is going to change
Yeah.
the way we do business. There will be companies who will decide to be a virtual company. It's absolutely happening. We see it happening. So, you know, if I say the words campfire to you all, or I say Paradise, California, anybody recognize those names?
Paradise was where the flames came in. Yeah.
Right. That's where an entire town was burned to the ground. The entire thing. 30,000 people were displaced. And we have 10 clients up in that region, up in the Chico, California region. 10 different companies, and some of which, by the way, you know, their employees lost their lives. And now on top of that, the COVID. And one of their big challenges is there's no housing for people. And so people are trying to, you know, relocate from other areas. If they get hired, and there's no place for them to live. I mean, these are really challenging, you know, issues. And so now that they've gone virtual, one of the CEOs was saying to me the other day, this is not so bad. And we could have people from almost anywhere working for us. And they had a heck of a time. They're an engineering company, so they had to have a lot of data power, because they had CAD machines moved to people's homes and all of this technology equipment. And so it was a nightmare, but they conquered it, and they did it quickly. And now they're saying, maybe this is not a terrible way to work. So, and this is a company that's so traditional, you know, everybody lives and works in that region, and you can't go south of that region because the cost of housing, as soon as you get down towards Sacramento, the cost of housing goes up exponentially, right? It's huge different market than it is up in the Chico area. So look, you know, necessity is the mother of invention, right? So here we are saying, how are they operating now? And we're going to see this for lots of people now. Healthcare, you know, we've got to deliver services, but think about how much telemedicine grew during the COVID virus.
Oh, yeah.
What's the impact of that?
I would add too, back to the subject of process, thinking about my client. Of course, they do patient surveys when people leave the hospital and while they're there, and their patient survey numbers have just tanked. Even though they've you know, everybody's stressed, of course, and all this, and it's been very, very difficult. But they've had really, really poor results on their patient surveys. So they're having to think about process and how they will serve people in the future and how they get those numbers back up. So I think it was Bob that asked about process, but that's something I know they're gonna continue to look at, is how they improve that patient experience.
Absolutely.
Any other thoughts or comments? Wendy, are we free to dismiss?
Yes, you are free to dismiss. I thank both Kim
You have to raise your hand.
I thank Kim and Jerry for spending their time and sharing some of their knowledge with us and having good conversations.
Kim and Jerry, it was great to see your faces.
Hey,
Yeah.
we love you guys, and you be well and be safe. That's the
Yes,
most important
absolutely.
thing. You bet.
Yes, thank you. Have a great rest of the day.
Bye.
Take
Bye-bye.
care.
Hey.
Bye. Thanks, Wendy.
You're welcome.